welcome to another video of physiology. In this video we're going to talk about the interstitial fluid, Starling force and lymph flow. So please subscribe to our channel and let's start. So what is the Starling force? When the blood arrives to the capillary, we have two different spaces that we need to talk about. First, inside the capillary, which has the plasma, and outside, which has the interstitial compartment and interstitial fluid. And the pressure in the interstitial fluid and capillary are different. Why? Because of two reasons. First, one of the pressure that we have is coming from our heart. So when the heart contracts, they make some pressure, and this pressure goes to the vessels as a systolic pressure, and then they arrive to the capillary, and we know it as a hydrostatic pressure. And the other pressure that we have is because of the difference between the concentration of the proteins. So we have some amount of protein inside the vessels and some amount of the protein in the interstitial space, and these two are different. And according to the osmosis law, the difference between the concentration in two different places can cause the fluid movement. So let's talk about them. Fluid move between the plasma and interstitial fluid via the osmosis. So in the osmosis, fluid will go from the low concentration place to the high concentration place. So just imagine you are in two rooms, that in one of the room there are like 10 people and the other room is like 5 people. So if more fluid go to the room with 10 people, the concentration between these people will be less. So this is exactly same as here. So what is the Starling force? A Starling force is the hydrostatic pressure and osmotic pressure. We're going to talk about each one of them in detail. What is the Starling force? Look at this equation here. The J is the fluid movement, what we gonna talk about, and K is the conduction velocity. This K will be constant, so we don't need to be worried about this. But the hydrostatic pressure, which we have it here, the hydrostatic pressure of the capillary and hydrostatic pressure of the interstitium, and oncotic pressure of the capillary and oncotic pressure of the interstitium, the difference between them make this fluid movement positive or negative. We're gonna talk about this. The fluid move across the capillary wall, and there is a balance between this hydrostatic pressure and oncotic pressure that we will talk about them, and the result will be the outflow at the arterial end. So here is the capillary, here is the arterial end, here is the venous end. Here we mostly have outflow from the capillary, so the fluid will go to the interstitial space, and in the end of the capillary bed the fluid will return back to the capillary. And we have two terminations, which is called filtration. It means that fluid go outside the capillary, and absorption, which means that the fluid return back to the capillaries. So what is these four things that we talk in the Starling force equation? So capillary hydrostatic pressure, this is the pressure that comes from our heart, systolic blood pressure, and it's when they arrive to the capillary, in the beginning they are around 30 to 40 millimeter of the mercury, and in the end it will be 15. Why? Because this hydrostatic pressure decrease when they pass through the capillary wall, and this is the only factor that change. Other factor that we're gonna talk about, like interstitial hydrostatic pressure, oncotic pressures, they will be mostly constant. The interstitial hydrostatic pressure is like capillary hydrostatic pressure, but from the interstitial compartment side. And as you know, there is no systolic pressure there, no heart there, so the amount of pressure that they can make is very less, and this pressure is against because it's from the interstitial to the capillary side. So they help the fluid in the interstitial compartment to go back to the vessels. However, this pressure is very low, and because compared to the atmosphere it's negative, it's sometimes from like 0 to -5. And capillary oncotic pressure, this is the major factor against the filtration. So why? Because inside the capillaries there are a lot of proteins. However, in the interstitial fluid there is not that much proteins, so the concentration here is much more than concentration here. So fluid would like to go from the interstitial space to the place that there are more proteins, the concentration is more, so fluid will go this way. And this is the major factor against the filtration. So the major factor that help the fluid to go back to the capillaries. And as I mentioned, capillary hydrostatic pressure is 30 to 40 in the beginning and 15 in the end. And this capillary oncotic pressure is 25 all over the capillary. So from somewhere here in the middle, the oncotic pressure will be more than hydrostatic pressure, and that's the moment that absorption will be more than the filtration. So there are some conditions that the plasma proteins can change. They can decrease or increase. So if they increase, what's going to happen? The concentration will be much more. So there will be a higher pressure from the interstitial to the capillary side. So this pressure from 25, for example, it go to the 30 if the concentration of the protein increase. And what's going to happen? We will have a less filtration. Why? Because the hydrostatic pressure is the major factor, but the oncotic pressure, which is against the hydrostatic pressure, will increase, and that can cause much more absorption than filtration. So the filtration will be less. What is the relative coefficient? Relative coefficient is a mathematical way to show how things can pass through the capillary, and it's depend on the type of the capillary. For example, in brain, the endothelial cells are very tight to each other, so protein cannot pass, and water is the things that can pass. Oxygen can pass easily, carbon dioxide can pass. However, for example, in the liver, we have discontinuous type of the capillary, and they have a bigger space between the endothelial cell, and more material and product can pass. So for example, here protein can pass easily, and this relative coefficient is the number that we give to particles that they can pass. For example, water can pass easily without any restriction, so it's 0. The coefficient for water is 0, and for albumin in the brain, because they can't pass, it's 1. So if something can't pass at all, we give 1. If something can pass very freely and easily, we give 0. So if something is close to 0, it means they can pass. If something is close to 1, it means that they can hardly pass. So let's go. The fourth factor that we need to talk is interstitial oncotic pressure. So what is interstitial oncotic pressure? This is the pressure of the protein concentration here. So as we mentioned, there is also protein concentration in the interstitial fluid, but is less than the one in the capillary. And of course, when like 10, I give it in a number for a better understanding. So if 10 fluid by the oncotic pressure of the capillary go back to the capillary, one fluid will go in a direction of the capillary to the interstitial fluid, because the concentration here is much less. So the amount between these two will be benefit to the oncotic pressure of the capillary. So this force is toward the filtration. However, the pressure is very low because the concentration is low, and it's a start around the 0, and in the venule part it will increase a bit. And at the venule part there are some lymph vessels that they can take up the proteins inside the interstitial fluid that we're going to talk about it. So in the whole equation, if the fluid movement is positive, and I'm going to explain it in example for better understanding. So if this equation is positive in total, we have a filtration. It means that the capillary hydrostatic pressure is over than osmotic pressure, so fluid will go to the interstitial space. But if the sum is negative, we're gonna have absorption. Look at these examples for better understanding. As you can see, hydrostatic pressure here is 30, and this oncotic pressure is 26. So these are the major factors. That's why I mostly talk about about these two, because the hydrostatic pressure of the interstitium and oncotic pressure of the interstitium in a physiological condition is very low. So these are the two major factors that can change. So and I showed the direction. So capillary hydrostatic pressure, filtration, oncotic capillary pressure cause absorption, and if this number is greater than this number, we're gonna have filtration. However, here oncotic hydrostatic pressure is lower than oncotic pressure, so the final result will be negative. This is the equation that we had it here. So this is the same equation. We just removed the hydrostatic speed, like this hydrolytic conductance, and because it's a constant number, and these are the things that will change. So we're gonna have absorption if the total number is negative. So what is lymph? Lymph is the system that take up everything that cannot be absorbed by the capillary again. Or for example, there are some bacteria here, and they will go to the lymph system to be able to be removed by the lymph system, by the white blood cell there. So we have lymph capillary, then we're gonna have lymphatic vessel, and then we're gonna have lymph nodes. For example, when we get sick, our lymph node get bigger. Why? Because there are some bacteria there that our white blood cell are trying to fight them. So their amount will increase, and more fluid will go there, and it can cause the enlargement of the lymph node. And then we're gonna have lymph duct, and they are this lymph duct will go to the thoracic and right lymph duct, and then they go back to the venous system again. And in the GI tract, the lipid, they can't go to the blood directly, so they have to go to the lymphatic system via the chylomicron. It's something that you guys study in your biochemistry class. Lymph is produced at the 120 milliliter per hour. So in 1 hour, 120 milliliter of the lymph is produced, and in 1 day, the amount of the lymph fluid that produced is same as the amount of the plasma volume. Lymph flow back to the venous system by two mechanisms. First, they have a one-way flap, as we have it also in our veins, especially in our leg. So when the fluid will move through this way, this flap, they don't let this fluid to go back again. So the movement will be only in one direction because of this flap. And the other factor that can help to fluid movement, because actually heart doesn't, this hydrostatic pressure that we talk cannot help the lymph to go through the body. So one of them is the one-way flap. The other thing is the smooth muscle in the vessel of the lymphatic vessel. And the third factor, which is also one of the major factor, is the compression of the skeletal muscle around this lymphatic tissue. So the skeletal muscle that we have in our body, they can help the lymphatic fluid to go to move in the lymphatic system. And what is the edema? Edema is the major thing that you need to know about this topic. So all the important thing of this topic is because of the edema. Edema is something pathological, and when the fluid go to the interstitial compartment and they can leave there, we call it edema. This edema can have many reasons. It can be due to increase in filtration. For example, if the capillary hydrostatic pressure increase, the pressure of the, for example, the contraction of the heart increase, they can cause increased capillary hydrostatic pressure, and so we're gonna have more filtration. The second is oncotic pressure. As you remember, we explained that the plasma, the protein plasma concentration is the major factor for absorption of the fluid from the interstitial compartment to the capillary. So if the plasma protein level decrease, for example, in malnutrition, in the kwashiorkor disease, when you see children that they are very thin, however, they have a big abdomen because they have an edema. So they look fat, but they are not fat, it's just the edema. And the second thing is ascites. Ascites is a condition that the people that they have a liver problem and the oncotic pressure, because liver is the major factor that protein albumin, and when we have it, we have this problem in our liver, fluid will collect in the abdominal space because of the this absorption and filtration unbalanced. So we're gonna have ascites. You can search these two picture in Google and see the picture for them. And the third factor is the capillary permeability. So for example, all of us had this experience. For example, we have sensitive to something, we have an allergic to something, and for example, when you touch something, you see some vesicle under your hand, you see some edema under your hand. This is because of the increase in the capillary permeability. So for example, insect bite, or if you eat something that is that you are allergic to, it can cause increase the permeability of the capillary, so we will have more air filtration, then they can cause edema. The second factor is the lymphatic drainage impairment. As we explained, lymphatic vessels are the major factor inside the interstitial space, that they can collect things from the interstitial compartment. For example, if the proteins is there, if something there that they cannot be absorbed to the capillaries, so they will go to the lymphatic vessel. And if they are infected, or if they are damaged somehow, for example, they can be damaged by, for example, you break your leg and you can damage the lymphatic vessel there, or you get sick and your lymph node enlarge and they can make obstruction in the way of the lymphatic vessel, or in the case of the cancer, they can also cause obstruction of the lymphatic nodes. And the second thing is prolonged lack of muscular activity. For example, you see that old patients that they are always on their bed, they have the edema on their leg or in their back, and it's because they didn't have movement for a long time, and this skeletal muscle didn't work. And if they don't work, the lymph vessel cannot pass the fluid, because we said it's one of the major factors that can help the lymph fluid to pass through the lymphatic system. And the factors that are against edema, if the lymphatic if the lymph flow is continuous and there is no obstruction, so they can remove the edema from the edema site to like lymphatic system. And if we remove protein from the interstitium, so there will be more protein inside the capillary, so capillary oncotic pressure will increase, and they can cause the absorption of the fluid to go back to the capillary. And the negative interstitial fluid pressure, so when it's negative, we're gonna have more absorption.